Hello class, my name is Lindsay and today I will be talking about the promotion of DTap and Tdap vaccinations. The targeted population in this project was originally going to be public health nurses. I was going to educate them in hopes to eventually target age groups between the ages of 19 to 64 years old. Due to the recent outbreak of COVID-19 and its quarantines that are currently taking place, my plans have changed. Many people in the office are telecommuting from home, so I'm unable to do my teaching project there. So now I will be educating family members who are in the medical field. So therefore, by educating them, they will be able to give information on how to educate others in their careers as well. There will be a pre-test and a post-test to assess my audience learning needs. We'll also have an open discussion at the end of the presentation. I felt that my population was appropriate because nurses can be really from ages in the teenage years to the elderly, depending on if you're LVN or an RN, so this information is beneficial to a very wide age group. The purpose of this presentation is to educate or inform you on the importance of DTap and Tdap vaccinations in all age groups. Okay, let's get started. The DTap vaccination is an immunization that protects against diphtheria, tetanus, and pertussis in children, and the Tdap is a vaccine that protects against all other age groups. There's a question of why age groups beyond childhood do not receive this vaccination. This problem is relevant because an adult who is immunized against Tdap could potentially save the life of an infant. The problem here is that most adults, they're not even aware that they need this vaccination. On the other hand, people do not know the importance of vaccines in general at every stage of life, and especially for this one in pregnancy. According to the CDC, there are about 24.1 million pertussis cases per year worldwide, with about 160,700 deaths. Pertussis is a serious illness that shows about 9 out of every 10 babies require hospitalization due to the complications it possesses. Now let's talk about why these vaccines are so important. Let's start with the origin of Bordetella pertussis. This is also known as whooping cough. Here we're going to touch on its history as well and the symptoms. So why are these vaccines so important? Pertussis is a respiratory tract infection. This is highly contagious. It lasts for weeks to months. It's spread through droplet, and as I already mentioned, it's known as whooping cough. It was recognized in the 16th century in Paris. Some of the complications that were seen is apnea, pneumonia, abdominal hernias due to the constant coughing, dehydration, sudden death, bruises or fractured ribs due to the coughing, broken blood vessels in the sclera, again, due to the strain and the severeness of a cough, seizures, and brain inflammation if it gets to that point. So this was once thought of as a common childhood illness back in the 20th century. When they noticed that children started to have a high mortality rate, this is when things started to get talked about as being a problem, and it's not a common just childhood illness. In the 1940s, the first vaccine was created, and since then, mortality rates of pertussis have decreased by 80%. Vaccines are important because these things can reoccur if there wasn't a vaccine. So now we're going to talk about CDC recommendations You're probably wondering what the difference is between DTap and Tdap vaccines. The DTap is what's given to infants during their first years of life and children before the age of 7. Tdap, on the other hand, is given to children who are above that age and go into adulthood, or those who have never received the vaccine at all. So now we're going to talk about the CDC's recommendations and statistics on DTap vaccines, and then we're going to look at Tdap and kind of compare the two. So DTap vaccines, the CDC says they're recommending infants to have a 5-shot series. The first will start at 2 months of age, then 4, then 6 months. Additionally, to build up immunity, there should be 2 booster shots that are needed between the ages of 15 to 18 months old, and then again between the ages of 4 to 6 years old. These are given, this vaccine is started in the first years of life because this is when they see this disease being most severe. So it's very important that especially children during the first years of life receive this vaccine. Half of babies without this vaccine are hospitalized due to the complications that pertussis gives off. I would also like to talk about how unvaccinated people can carry and infect others up to 3 weeks. So if a child does not have this vaccine, but an adult is a carrier, they can very well pass this on to the infant, and they could potentially die from it. Now I'm going to talk about the Tdap vaccine. So the CDC recommends this for all ages. Tdap to teens who did not get the shot when they were a baby. They'll need a Tdap vaccine. Tdap is also given to pregnant women. Now, this is given to pregnant women because it gives passive immunity onto the baby, so it protects them before birth. The Tdap vaccine is also given to those, like I said, who have never received a vaccine at all, and then they recommend a booster every 10 years. All ages who are immunized helps reduce infants of becoming infected by 20%. So they're able to prevent this in babies. Now I'm going to move on, and we're going to talk about some risk factors and some statistics of pertussis. So some risk factors obviously are infants below the age of 12 months old. Another risk factor is asthma or being immunocompromised. The greatest risk, however, is being around people who are unvaccinated, or also living in a household of unvaccinated people. That puts infants at risk of becoming infected by 80 to 100%. Another major risk factor is people who travel. This is still a problem in other countries who do not have, vaccines available like the United States. So those who travel pose a great risk factor. Some statistics I'm going to talk about are in 2012, there were about 48,277 cases in the U.S. In 2014, pertussis ranked as the deadliest vaccine-preventable disease. In 2014, infants less than 2 months old accounted for 40% of the United States cases that were reported. In 2015, in Soviet Scotty, Canada, showed mean age actually being 15 years old. So this just goes to show that even though you are past the first years of life, it's still important for even teenagers to get vaccinated in adolescence. as well as adults. Globally, there was 24.1 million cases of pertussis each year, according to the CDC. And like I said, among those cases, there were about 160,700 deaths. Okay, so this concludes the presentation. Now I'm going to give a post-test on what you've learned, and then we will also be doing a demonstration. I will demonstrate, and then I will have you repeat back to me or show me how you will swab a patient for pertussis, and we'll talk about the types of isolation precaution that a patient with pertussis would have, and how to apply that PPE and remove it in order to protect you, because like I said, it's droplet precautions. And then we're going to follow up with questions that you may have. Thank you.